Hi there. In this video, we're going to look at how our systems can prompt you that there are things the patient needs to talk to you about. So if, say, you're a clinician, I understand it's not unusual for a patient to rock up and neither you nor the patient are entirely sure why they're attending. There's some stuff to set up in the background for what I'm about to show you. We'll cover that in a separate video. But here I just want to show you what happens with my cat if I do start consultation. So it's flagging up for me that the patient is due a follow-up with a clinician and that there are actions needed from pathology. There's a few options here. The two most common ones I think will be view details, which we'll come to in a moment, or of course there may be times you're on call, the patient's having an MI, and you're going to put unable to action. But say that you are able to discuss with them, or at least you think there's a possibility. Click View Details. That adds this note in here, which our systems will then use when you save the record. And it will then bring up this view, why am I seeing this patient? Unfortunately, it's a little slow at times. We're trying to speed that up. What this view is doing, though, is trying to display what are the different things our systems have picked up that the patient needs. So we can see here, follow-up is due with a clinician because recent vitamin D needs discussion. So the latest vitamin D is less than 25, but there are in exclusions for prescribing high-dose vitamin D. Now, these 3 stars mean that I can right-click an action, and in this case, that would launch the template, or I can just go straight to the template from the buttons up here. Here, I've got a bit more information if I want it. I can see what the latest vitamin D was, when they were last prescribed it, and why there's an exclusion. So if that exclusion wasn't in place, our system would have prompted someone to just prescribe high-dose vitamin D, but it may or may not be appropriate in this instance. Now, if you're able to, it's great if you can use this and record that you've discussed with the patient and whatever the outcome is there. Not only does our system use that to know that it's been discussed, but also the notes you put there will be then saved in this template for future reference. Or you can use this to, say, record and issue high-dose vitamin D. But of course, there's possible that you forget to do that. It may be that you have a brief discussion about it, but other things as well. So when you then come to save the record, if you've picked this option that you're going to view the details, it will then ask, have you completed the outstanding follow-up? So no does nothing. Info would take you back to the template, but if you know you've discussed the things that are there, you click yes. That will add some codes in the background, and that will effectively tick that off for the patient and avoid that patient getting further invites. That was a fairly simple example. These things can get a little more complicated. There can be different things that get displayed. There can be occasions patients have multiple reasons that need following up. Just a flag, if you say yes, you follow them up, it will code it according to kind of your role and the type of follow-up. So if, for example, there was follow-up with a respiratory nurse, but you're a GP and it's flagged up as follow-up with you as a GP or clinician, and you say you've done it, that won't clear the respiratory one, but it would clear any follow-up that's linked to the GP. So it may be that you need to just double check that everything's been done. But yeah, if you've done it, click yes, codes are added, and everything will then be taken care of. Thanks.